would like to talk to you about pelvic organ prolapse. Hi, my name is Dr. Alexandra Dubinskaya, and I'm a urogynecologist and a founder of Los Angeles Institute for Pelvic and Sexual Health. Pelvic organ prolapse is a very common condition. About 1 in 3 women who gave birth vaginally will develop prolapse at some point. What are some risk factors for developing pelvic organ prolapse? Well, genetic is one of them. Same way how some women might have 0 wrinkles when they're 75, and some women have tons of wrinkles. Same story. It's all about your connective tissue. Speaking of which, people who have connective tissue disorders, chronic medical conditions like coughing or chronic constipation, being pregnant or giving birth, especially vaginally, anything that increases the pressure on your abdominal wall will increase your risk of developing pelvic organ prolapse. There's 3 organs that can be prolapsing or sliding from its normal position. And we perceive it as a feeling of bulge, of fullness inside. Bladder, and sometimes we call it cystocele, uterus or uterine prolapse, or wall between vagina and rectum pushing to that posterior vaginal wall, and it's called rectocele. A lot of women have some degree of prolapse, and when they don't have any symptoms, we don't really need to do anything about it. But when women develop symptoms of fullness and pressure and sometimes back pain, it might be time to get evaluated. What are the options for women who have this condition? Pelvic floor physical therapy can help. It's not going to put the organs back on that place, but it can help the symptoms. Pessary is a device that's been used for many, many years. Made out of medical-grade silicone, we place it inside of the vagina, and it supports the organs and keeps it in place. There are 2 different types of pessary. One that women can manage on her own. It's usually a ring or ring with support. And the pessary, you need the help of the physician to remove it, clean it, and replace it. That creates the suction behind it, usually used for more severe prolapse. And that pessary called Gellhorn. There are also different surgeries that can help fix the prolapse. For the bladder prolapse or cystocele, we can do a cystocele repair. That's a pretty simple outpatient surgery done through the vagina, where we make a small incision on the anterior wall of the vagina, find those ligaments that separate it, put them together, and close the skin over. For the rectocele, is also a very similar procedure, where we make incision on the posterior wall of the vagina, find the separation in a support system, put it together, and close the skin. For the uterine prolapse, the surgery can get a little bit more complex. It can be done through the vagina or through the stomach. There are 2 procedures that are done through the vagina: sacrospinous ligament suspension and uterus sacral ligament suspension. The second one require you to remove the uterus because we open the top of the vagina and attach the top of the vagina to the ligaments inside of your body. For abdominal procedure, it's called sacrocolpopexy. It can be done through the big incision, laparoscopically, or robotically. In that procedure, we use a synthetic material called mesh, same mesh that's been used for hernia repair for many years. And we attach 1 piece of mesh to the top of your vagina and another piece to a very strong ligament next to your tailbone. This procedure can be done removing of the uterus or with preserving the uterus. Also, this procedure has a very high success rate, about 95% in a year arc. If you think that you might have a pelvic organ prolapse, you should discuss with your urogynecologist what procedure suits you the most, taking in consideration your lifestyle, your health conditions, and activity level.